Childhood mental health. Mental health problems can disrupt daily life at home, at school, or in the community. Without help, mental health problems can lead to school failure, alcohol or other drug abuse, family discord, violence, or even suicide. However, help is available. Talk to your healthcare provider if you have concerns about your child's behavior. Mental health disorders are diagnosed by a qualified professional using the Diagnostic and Statistical Manual of Mental Disorders, DSM. This is a manual that is used as a standard across the profession for diagnosing and treating mental disorders. When you have a concern about a child, what's in a label? Children are continually evaluated as they enter and progress through school. If a child is showing a need, they should be assessed by a qualified professional who would make a recommendation or diagnosis of the child and give the type of instruction, resources, accommodation, and support that they should receive. Ideally, a proper diagnosis or label is extremely beneficial for children who have educational, social, emotional, or developmental needs. Once their difficulty, disorder, or disability is labeled, then the child will receive the help they need from parents, educators, and any other professionals who will work as a team to meet the student's individual goals and needs. However, it's important to consider that children that are labeled without proper support and accommodations, or worse, they may be misdiagnosed, will have negative consequences. A label can also influence the child's self-concept. For example, if a child is misdiagnosed as having a learning disability, the child, teachers, and family members interpret their actions through the lens of that label. Labels are powerful and can be good for the child, or they can be detrimental for their development, all depending on the accuracy of the label and if they are accurately applied. A team of people who include parents, teachers, and any other support staff will look at the child's evaluation assessment in a process called an Individual Education Plan, IEP. The team will discuss the diagnosis, recommendations, and the accommodations or help, and a decision will be made regarding what is best for the child. This is time when parents or caregivers decide if they would like to follow this plan, or they can dispute any part of the process. During an IEP, the team is able to voice concerns and questions. Most parents feel empowered when they leave these meetings. They feel as if they are part of the team, and that they know what, when, why, and how their child will be helped. Childhood mental health disorders. Social and emotional disorders, phobias, anxiety, post-traumatic stress syndrome, PTSD, obsessive compulsive disorder, OCD, depression, developmental disorders, autism spectrum disorder, ASD, attention deficit hyperactivity disorder, ADHD, pervasive developmental disorder, PDD. Phobias. When a child who has a phobia, an extreme or irrational fear of or aversion to something, is exposed to the phobic stimulus, the stimuli varies, it almost invariably provokes an immediate anxiety response, which may take the form of a situational bound or situational predisposed panic attack. Children can show effects and characteristics when it comes to specific phobias. The effects of anxiety show up by crying, throwing tantrums, experiencing freezing, or clinging to the parent that they have the most connection with. Related conditions include anxiety. Anxiety. Many children have fears and worries, and will feel sad and hopeless from time to time. Strong fears will appear at different times during development. For example, toddlers are often very distressed about being away from their parents, even if they are safe and cared for. Although fears and worries are typical in children, persistent or extreme forms of fear and sadness could be due to anxiety or depression. Because the symptoms primarily involve thoughts and feelings, they are called internalizing disorders. When children do not outgrow the fears and worries that are typical in young children, or when there are so many fears and worries that interfere with school, home, or play activities, the child may be diagnosed with an anxiety disorder. Examples of different types of anxiety disorders include being very afraid when away from parents, separation anxiety, having extreme fear about a specific thing or situation, such as dogs, insects, or going to the doctor, phobias, being very afraid of school and other places where there are people, social anxiety, being very worried about the future and about bad things happening, general anxiety, having repeated episodes of sudden, unexpected, intense fear that come with symptoms like heart pounding, having trouble breathing or feeling dizzy, shaky, or sweaty, panic disorder. Anxiety may present as fear or worry, but can also make children irritable and angry. Anxiety symptoms can also include trouble sleeping, as well as physical symptoms like fatigue, headaches, or stomach aches. Some anxious children keep their worries to themselves, and thus the symptoms can be missed. Related conditions include obsessive compulsive disorder and post-traumatic stress disorder. Post-traumatic stress syndrome, PTSD. Exposure to traumatic events can have major developmental influences on children. While the majority of children will not develop PTSD after a trauma, best estimates from the literature are that around a third of them will, higher than adult estimates. Some reasons for this could include more limited knowledge about the world, differential coping mechanisms employed, and the fact that children's reactions to trauma are often highly influenced by how their parents and caregivers react. The impact of PTSD on children weeks after a trauma show that up to 90% of children may experience heightened physiological arousal, diffuse anxiety, survival guilt, and emotional liability. These are all normal reactions and should be understood as such. Similar things are seen in adults. Those children still having these symptoms 3 or 4 months after a disaster, however, may be in need of further assessment, particularly if they show the following symptoms as well. For older children, warning signs of problematic adjustment include repetitious play, reenacting a part of the disaster, preoccupation with danger, or express concerns about safety, sleep disturbances and irritability, anger outbursts or aggressiveness, excessive worry about family or friends, school avoidance, particularly involving somatic complaints, behaviors characteristic of younger children, and changes in personality, withdrawal, and loss of interest in activities. Obsessive compulsive disorder, OCD. Although a diagnosis of OCD requires only that a person either has obsessions or compulsions, not both, approximately 96% of people experience both. For almost all people with OCD, being exposed to a certain stimuli, internal or external, will then trigger an upsetting or anxiety-causing obsession, which can only be relieved by doing a compulsion. For example, a person touches a doorknob in a public building, which causes an obsessive thought that they will get sick from the germs, which can only be relieved by compulsively washing their hands to an excessive degree. Some of the most common obsessions include unwanted thoughts of harming loved ones, persistent doubts that one has not locked doors or switched off electrical appliances, intrusive thoughts of being contaminated and morally or sexually repugnant. Depression. Occasionally, being sad or feeling hopeless is a part of every child's life. However, some children feel sad or uninterested in things that they used to enjoy, or feel helpless or hopeless in situations where they could go do something to address the situations. When children feel persistent sadness and hopelessness, they may be diagnosed with depression. Symptoms. We know that youth who have depression may show signs that are slightly different from the typical adult symptoms of depression. Children who are depressed may complain of feeling sick, refuse to go to school, cling to a parent or caregiver, feel unloved, hopelessness about the future, or worry excessively that a parent may die. Older children and teens may sulk, get into trouble at school, be negative or grouchy, are irritable, indecisive, have trouble concentrating, or feel misunderstood. Because normal behaviors vary from one childhood stage to another, it can be difficult to tell whether a child who shows changes in behavior is just going through a temporary phase or is suffering from depression. Treatment. With medication, psychotherapy, or combined treatment, most youth with depression can be effectively treated. Youth are more likely to respond to treatment if they receive it early in the course of their illness.